The only thing Joyce Turimagendo can talk about is the excruciating pain in her head. She developed a tumour 10 years ago. Doctors say they suspect it's cancer and that it will eventually kill her. Her son Wanje says they can't afford any treatment, so they make do with paracetamol from the local shop.
We went to the hospital, and I don't know what medicine they gave her. Since then, we have only been giving her mild painkillers, and the pain continues.
A picture of Joyce taken a decade before is barely recognizable. In a developed country, her last years would have been made bearable with morphine. It's a strong painkiller widely used in the West. Joyce's family showed us this scan. This is from the last time she went to hospital. It's dated 2011. Since then, it seems they've given up hope. They don't know what to do. And they say they've never even heard of morphine. Their home's about 12 kilometres from the closest health centre, and there's no morphine available there. Even if there was, healthcare workers don't have the resources to bring it to people who are bedridden out in the community. An hour's drive away in Uganda's capital, Kampala, things are slightly better. Staff at this charity hospice prepare morphine in liquid form to be taken to patients at home. In many African countries, colonial-era laws ban the drug. Uganda's laws and programs are among the most progressive, and morphine's cheap, but it still only reaches about 10% of the people who need it. Dr. Anne Merriman founded the hospice. She's spent 30 years working to improve care for terminally ill patients and others in pain across Africa. This year she was nominated for a Nobel Peace Prize. She told us many medics and politicians are still wary of morphine.
They still think it's a very addictive drug, that it's going to be abused. They're afraid to use it. So you can train people how to use it, and they lose their fears and they go out and they're with colleagues who absolutely won't use it. And these are senior colleagues, and the senior ones are the worst. The ones of my age are the worst.
Meanwhile, Joyce's family struggle to even give her a drink. Morphine access is slowly increasing, but it hasn't reached her yet. And so she's one of the millions across Africa who still have to suffer to the very end. Malcolm Webb, Al Jazeera, Luwero district.